So glue is also known as otitis media with effusion. It's an accumulation of non-infected fluid in what we call the middle ear space. So if you go down the ear canals, you have an eardrum at the end. Behind that is a space which ideally would be filled with air. But for quite a number of children, there's an accumulation of fluid, sometimes thick fluid, which is why we call it glue. In terms of adults and children, it's very similar in terms of the presence of fluid. It's far more common in children because normally, for normal functioning of ears, we rely on special tubes called eustachian tubes, which allow air to pass through our nose up those tubes to the ear, and they equalize the pressure, a bit like being on an aeroplane. For quite a number of younger children, those tubes are not necessarily very effective, and that makes the accumulation of fluid, of glue, more likely. Usually for most children as they grow up, those problems are then less common, although it is something that can affect older children and adults. Some will have longer term eustachian tube problems, also called eustachian tube dysfunction. And occasionally, if there was some blockage of one of those tubes, that could also cause it as an adult as well. Many children will suffer from glue, but for many of them, it will be on one ear. It may be quite brief episode that self-resolves. So it's very common that there may well be no significant symptoms at all. Typically, it doesn't cause any significant pain, but could cause some intermittent mild pressure symptoms. The most concerning symptom is regarding potential hearing loss, particularly if it's affecting both ears, and it can distort the sound that's passing through the ears as well. This can then have a knock-on impact on a child's speech and language development. It can also impact their behavior. Tinnitus is something that if an adult had hearing loss of any sort, including glue, we would often complain about it. Older children will more often complain of tinnitus, but younger children struggle to put that into words. So it's not necessarily something that they will often complain about, but in my experience, if you ask very specifically, it's quite often present when glue is also there. Glue can affect behavior in a variety of ways. It certainly can make children less responsive to other children, older children, parents, teachers at nursery and school. It may be things like not answering and not responding to their name. Sometimes it means the television volume may be higher than usual or their tablet volume. Sometimes it causes some frustration in the sense if it's impacting their ability to hear and to be involved in what's going on and impacting their communication. Certainly frustration can be quite a significant part of it. Some children will withdraw from social circumstances with their friends because they're simply not able to hear exactly what's going on. In terms of the hearing, as the sound waves pass through the ear and are muffled somewhat by the glue ear, this can cause significant problems in terms of children replicating their speech. That's how children really all learn, by hearing other children and adults speak and pronounce their words and certain syllables, and then practicing by replicating. So if those are not clear, then it can be extremely difficult for them to try and replicate those words and develop their speech skills effectively. So for some children, if the glue was mild and temporary or affecting one ear, it may well be that no treatment is required at all. For some children, simply some monitoring is appropriate, and at times hearing testing as appropriate to monitor a child and make sure that there are no significant adverse effects. There are broadly two effective treatment options, though, if the glue is an issue. One is hearing aids, and there are kind of two options. One is a behind the ear hearing aid, and the other is stuck into a bit like a sweatband. It's called a soft band. That's where the hearing aid sits against the skin. Those don't resolve the glue, but they turn up the volume so that the hearing ability is significantly better. The alternative is something called grommets, also known as ventilation tubes. That requires a very small, brief operation under general anesthetic to insert. But it's around a 3mm plastic tube, which sits in the eardrum with a little flange on each side to keep it in place. A lot of the glue ear, the fluid, is sucked out at the time of surgery, but really then, instead of relying on the body's own eustachian tubes to get air up to the ears, the air is able to pass through the center of the grommet to then allow the glue to dissipate and in order to optimize the hearing. And typically within a few days after surgery, the hearing is improving quite significantly with grommets. I wouldn't say there are any reliably proven novel treatments, but certainly research has helped us refine which children need treatment, when to treat, and what the most effective options are. So one home remedy which can offer some children some help is a bit like pinching the nose and popping the ears on an aeroplane, and doing that on a regular basis, 2 or 3 times a day at home for a few weeks. The idea is that we are encouraging air and pressure to build up at the back of the nose, encourage that air up to the middle ear space where the glue ear is, and encourage the dissipation of the fluid. It certainly doesn't work for all children, but it can for some. That can be effective for slightly older children, but younger children will often not understand how to carry that procedure out. So an alternative is buying something called an Ottovent balloon, which is only a few pounds and can be bought in shops and online. And that is a small balloon which is held against the nostril on one side, with the other nostril being closed. The child takes a big breath in and tries to blow up the balloon. And because they're able to visually see what's happening, they're able to better understand. Certainly for a number of children it doesn't work, but it can offer some improvement for others. The alternative isn't exactly a resolution for glue ear, but it's about optimizing the communication that happens at home and school and nursery. It's about making sure that parents are speaking to their children directly so that the children can see mouth and facial movements, speaking at a good volume, trying to minimize within reason some of the background noise as well. And even that action can be quite effective and helpful for children as well.